Hello, my name's Finnie. I'm a clinical neuropsychologist working for Berkshire Healthcare Trust. I'd like to talk to you today about the role of a clinical neuropsychologist. Neuropsychologists are specialists who are involved in assessing and rehabilitation of people who've experienced a brain injury or have a neurological disease. They can also get involved in clients who are born with a neurodevelopmental condition such as autism or ADHD. Neuropsychologists focus on the relationship between brain, behavior, cognition, and emotion. They look to see why the brain or how the brain can impact on each of these different areas. And we incorporate knowledge of mental health conditions that have specialist knowledge within the neurosciences. Neuropsychologists work in a variety of different settings. We can work in acute or community hospitals, often working with clients who are inpatients after a stroke or traumatic brain injury, or who are having significant difficulties related to a neurological condition such as MS. We also work in community teams, for example, shortly after people are discharged from hospital in early stroke discharge teams or community-based neuro rehab teams when people leave hospital after having had a brain injury or a stroke and need additional support. These are often multidisciplinary teams. We also work in specialist psychological therapies, for example, the type of environment that I work in primarily, a neuropsychological service, where we see clients for outpatient appointments when they are often a few years after a brain injury or neurological illness, and they are seeking advice on their ongoing support and care. These specialist services can also contain autism and ADHD assessment services, either in the children's sector or for adults. Neuropsychologists are essential within a memory service, supporting the diagnosis and management of dementia and other neurodegenerative conditions. Neuropsychologists can find themselves working in prison or forensic settings, and there is a huge overlap with clients with brain injury or neurodiverse conditions who are present within prison populations. Some neuropsychologists go on to become privately employed in their own practice or working as an expert witness in the court environment. Neuropsychologists can also stay within the academic sector, teaching and training in educational psychological programs and involved in research. So the range is quite broad. Typical day in the life of a neuropsychologist would be often in front of a client, providing assessments and rehabilitation sessions. We do really quite comprehensive assessments, and I find myself very fortunate to be able to spend hours, sometimes 3 hours, with a client in order to get a full understanding of their history and the current strengths and challenges that they have. We are responsible for making diagnosis and signposting clients to relevant services within the NHS and also within the community. So it does allow nice close collaboration with charitable organisations and other community networks. We might be involved in running groups for people with neurological conditions or providing one-to-one neurorehabilitation. And often our work involves psychoeducation, helping people to understand the difficulties that they face to either the client or to the families and carers working with them. And we're very often found within multidisciplinary teams, working with physiotherapists, occupational therapists, and speech and language therapists. It's a long pathway to become a neuropsychologist, as it is for most other psychological professions. You need to complete a clinical psychology doctoral training program. And then if you want to be recognised as a clinical neuropsychologist within the BPS, there is also a postdoctoral diploma called a British Psychological Association's Qualification in Clinical Neuropsychology, or QICN. This is a diploma that's taught in modules and also requires a 2-year portfolio of clinical neuropsychological cases. However, it's not entirely necessary, and many clinical psychologists will choose to work in an area of neuropsychology without this particular training or qualification. So my journey to qualifying was a little bit unusual. Started very typically. I did A-levels in psychology, sociology, maths, and I volunteered in a number of different places, most notably in a stroke group and Older People's Day Centre. I did my psychology degree at the University of Bath, and that was wonderful in that it included 2 placements, one in a CAMS service and one in a neuropsychology service. I also led the counselling service while I was at university. When I finished university, I then changed course a bit. I accepted a job as a research assistant for a company that provided cognitive testing to pharmaceutical companies. So the responsibility there was to see if and how medications were impacting on cognition, either because they were wanting to, because it was to treat dementia, or as an unwanted side effect. And I loved that job, and I continued to work in the pharmaceutical industry for a further 2 years in project management. However, I then moved to Australia and decided that I would go back to my roots and see if I could retrain to work clinically as a psychologist. In Australia, they have a different program, so you can either train at a doctoral level as a clinical psychologist or as a clinical neuropsychologist. And my area has always been in neuropsychology, so I trained as a neuropsychologist in Australia, and that gave me the qualification as a doctor of clinical neuropsychology. So it's different from what I was just describing for the UK pathway. Highly recommend moving to Australia for 10 years to do that. It was great. In 2017, I moved back to the UK. My qualifications have been recognised by the UK system, and I returned to work and I started to work for the NHS for the first time. And I'm very pleased to now be leading the neuropsychology service in Berkshire. If you want to learn more about neuropsychology or have a particular interest in this area, I encourage you to contact your local neuropsychology service or memory service or community-based neuro rehab team. You could also try the local hospital to see if there are neuro rehabilitation units at the hospital. Volunteering options would include Headway, a fantastic resource that provides brain injury awareness and support groups to all age of clients, or local support groups, dementia care agencies, learning disability support groups, or autism and ADHD support services. In Berkshire, there's a group called Autism Berkshire. It's always helpful to contact your local volunteering bureau to see what else is available. If you'd like further information, you can visit the BPS website or the other spaces listed on this slide. And we have some leaflets that we are able to provide that give a summary of what I've discussed today. I hope that you've enjoyed hearing a bit more about clinical neuropsychology, and perhaps I'll meet you one day if you remain interested in this area. Thank you. Bye-bye.